Good afternoon, everyone. Thank you for those updates, Governor. I also want to recognize the army of people inside and outside of state government who have been working extremely hard, almost around the clock, 7 days a week, to inform the thoughtful approach the governor described. I want to be clear that each of these steps are fully informed by our public health guidance. We're engaged in every element, balancing public health and opening the economy, knowing that it's connected and it determines our ability to do it safely. So stay with us in being flexible and in being adaptable, and you'll know that public health guidance, data, and science is what's driving every step for Rhode Island. I want to use that to also reiterate it is critical that we follow the stay-at-home order that continues to be in place now. That is really the only way that we're able to say 2 weeks from now that we can initiate the steps shared for phase 1. We all have to work together in ensuring that. If folks start loosening up now, that can result in changes in the numbers that the governor shared regarding hospitalizations and cases, and would subsequently result in pushing back the initiation of phase 1. However, if we all hold on and we all continue following the stay-at-home orders now, preparing and thinking about what has been shared and what will come forward in 2 weeks from now, then we can take those steps safely and carefully together. A lot has changed over the last few weeks and months in terms of the science on COVID-19. And it's our responsibility from a public health standpoint to make sure that we stay up to speed and use the science that we learn, the conversations that we're having nationally, engaging with people across the world, directly informs the steps that we're thoughtfully taking here in Rhode Island. I want to reiterate that although there has been new knowledge added, the basics in science about how to prevent transmission of this virus has been very consistent. And that's what's going to guide us through these steps. It's those basic science-driven infection control principles that are going to guide our movement between the phases that the governor described. We know how the virus spreads, and we know the steps that work to stop that transmission. It's that information that we're going to use to make it so that as we are reopening the economy, we can address fears and concerns as people return to certain elements of business cautiously and carefully by applying those elements of science that we know work for addressing this virus, stopping transmission, and minimizing the risk of spread. That means we want to focus on making sure that people can do social distancing effectively. Needing to have that gap between people helps stop the virus from spreading from one person to another. That means making sure that we are wearing some form of cloth face covering or mask to protect others from being exposed to any viral infectious particles that may occur. That also means helping to make sure that we're doing the environmental cleaning that we know matters. As the virus spreads through droplets and lands on different surfaces, doing the environmental cleaning consistently also helps stop transmission from occurring. And we know that being able to expand testing and do effective contact tracing and providing the services needed to support people isolating and quarantining effectively, that's a way to separate from each other and stop transmission of the virus, We want to have the capacity to do that. We're building that, we have it, and we're getting better, particularly in the communities most significantly impacted, doing it also, though, across all of Rhode Island. It's going to be critical for us to have these measures continue to be in place as we move forward. That's what's going to give all of us the best reassurance with going forward, and it's what we have as the plans in place. So in terms of the data for today, we have 269 new cases to report. We also have 266 COVID-19 patients who are currently hospitalized. That includes 81 people who are in intensive care units, ICUs, and 56 people on ventilators. Unfortunately, we also have 7 new fatalities to report. There was one person in their 50s, one person in their 60s, one person in their 70s, and one person in their 80s. The remaining 3 people were in their 90s. All 7 of these people lived in congregate living or congregate care settings. I know that the Veterans Home has been in the news a lot lately, and I know that the governor talked about the Veterans Home a little bit yesterday. It's important to note that although these fatalities are unfortunate, and our thoughts and prayers go out to the families that are dealing with that, I want to also be clear with sharing the data. What we are reporting today among residents did not happen at any of the Vets Home in terms of fatalities. As the governor said yesterday, and as I have shared previously, in our congregate settings, we are handling any cluster of cases extremely aggressively. We know that it's a place where the virus can transmit more easily because people are closer together. And we know that we are dealing with an important medically fragile or physically fragile population that's at risk. For the Vets Home, I want to say thank you to the Vets Home leadership, General Backus, Director Yarn. We've been working closely as the Rhode Island Department of Health team and the National Guard team to get almost all residents and staff tested through this weekend and into today. We still have to test about 7 or 8 residents and a proportion of the staff. But at this point, 12 residents are positive and 2 staff members are positive. Unlike the first person who tested positive at the Vets Home on Friday, none of these residents that I've just reported are displaying any symptoms. So it's important to recognize there isn't a bunch of coughing or the usual COVID-19 symptoms that are occurring, but because we are taking the aggressive infection control approach that I've shared is important for us to do at this time in congregate care settings, it is allowing us to identify people who do not have symptoms but are positive for this illness so that in a setting such as this, where infection can spread more easily and you have a population that's at higher risk, we can make adjustments aggressively and quickly. So we're able to identify the residents who are positive, make sure they continue to receive the care that they need, and are separated from areas where the residents are negative. Similarly with the staff, it allows us to be aggressive in how we are responding and doing everything that we need to do. It's also, this also highlights why it's so important for people across the state to continue to take the steps the governor and I have been mentioning, even if you feel 100% healthy. Feeling healthy is important. as we're learning more about COVID-19, it does not mean that you may not be a carrier or have COVID-19. And so that's why it's important during this time, leading up to the phases, but not before, that everyone continues to stay at home order, that everyone continues to avoid groups of more than 5 people, interacting with just the same people each time. Everyone continues to wear cloth-based covering when in public, that you continue to wash your hands multiple times throughout the day, and importantly, continue to keep a distance of at least 6 feet from each other whenever possible, particularly in public or other settings. We continue to follow these important steps. It will allow us to move forward together with confidence and safely, taking care of Rhode Islanders. With that, I'm going to get us started with questions.
Doctor, if you would stay at the podium.